My name is Abisola Abosede, and my topic is innovation progress, video proposal signature, and I'm going to be talking about vitamin D deficiency, and it's related to my app, Dminder. Deficiency of vitamin D is as a result of lack of exposure to UVB, diet, and supplements. Individuals affected by vitamin D deficiency include inadequate UVB exposure, use of sunscreens with an SPF of 30 or higher, naturally dark pigmentation of the skin, BMI greater than 30 kg, obesity, presence of fat malabsorption problems, bariatric patients, use of a wide variety of medications, patients with chronic granulolar forming disorders, lymphomas, and primary hyperthyroidism. If an obese person loses approximately 50% of their body weight, this would have a positive effect on serum vitamin D concentration. Vitamin D is said to be reversible in some cases of autoimmune disease. Intake of vitamin D supplement diet or exposure to UVB prevent further damage. The next slide is the health status. This slide is showing the concentration of vitamin D needed to prevent vitamin D deficiency. The serum concentration of 25 hydroxy vitamin D less than 30 or less than 12 is equal to vitamin D deficiency. This can cause rickets in children, osteomalacia in adults. 30 to less than 50 milligram and 12 to less than 20 is vitamin D inadequate for bone and overall health. Greater than 50 or greater than 20 is vitamin D adequate, and greater than 125 or greater than 50 is potentially adverse outcomes. This picture here shows the causes of vitamins, causes um, of vitamin D deficiency, the medications and supplements that can cause that can exacerbate vitamin D deficiency. This includes anti-seizure drugs, corticoids, rifampicin, highly active antiretroviral treatment, St. John's wort. Malabsorption is Crohn's disease, Whip's disease, cystic fibrosis, celiac disease, liver disease. And the result of vitamin D deficiency can lead to hepatic failure, renal failure, nephrotic syndrome, obesity, and it can cause mentally it can cause seizure, schizophrenia, or depression. It can lead to infections such as its effect is on infections such as tuberculosis, influenza, upper respiratory tract infection. Its effect is vitamin D deficiency effect on lung disease include forced expiratory volume in 1 second, asthma and wheezing diseases, hypereffusion, cardiovascular disease, hypertension, cardiovascular disease. It can also lead to autoimmune disease such as type 1 diabetes, multiple sclerosis, Crohn's disease, rheumatoid arthritis, and also it can cause cancer such as breast, colon, prostate, pancreatic, and so on. Vitamin D deficiency is a major common health issue worldwide in all age groups. It's known as global epidemic. Prevalence of vitamin D deficiency. This diagram shows the prevalence of vitamin D deficiency in US, Canada, UK, and Germany. The blue color is the represents US, gray color represents Canada, the orange color represents UK, and the yellow color represents Germany. Factors influencing vitamin D status include microbiome, sun exposure depending on the season, PTH, calcium, age, sex, ancestry, genetic factors, supplementation, low dietary magnesium intake, alkaline phosphate, glutein, cysteine, thiol, distilled redox status, nutritional lifestyle patterns, vitamin D binding, and obesity. Impact of vitamin D deficiency on socioeconomic. This is a map of low countries with low, medium income, and low income affected by vitamin D deficiency. Financial vitamin D deficiency. This picture here shows the amount spent on flour fortification and supplementation in order to provide food enriched in vitamin D. I came across this study which says men with vitamin D deficiency had a higher anthropometric index than men with sufficient vitamin D levels, while no difference was observed between the two groups in women. Therefore, other contributing factors beyond obesity should be considered that modify the effect of obesity, such as intake of vitamin D supplements and the number of pregnancies. The northern half part of the rural mountains area of Busha province had the higher mean of vitamin D level than the plains and coastal areas. There was also significant difference in daily consumption of dairy and milk products between mountains area and other parts of the province. Past solutions. Considering widespread vitamin deficiency in all age groups and that natural sources of vitamin D cannot maintain circulating 25 levels in the recommended target of 30 to 50. Systemic vitamin D food fortification and targeted vitamin D supplementation may be suggested as effective strategy in order to combat with vitamin D deficiency. These strategies have been considered in Asian countries, US, Canada, and Finland. It has been shown in a modeling study that fortifying at least one food vehicle can increase per capita vitamin D supply to maintain serum 25 in lower middle income countries. First collaborator. A patient with osteoarthritis due to vitamin D deficiency, knowledge deficit of vitamin D has something in common with other collaborators. Reports a citing part of Dminder as getting alert to get in and out of the sun. And as the sun will weaken due to vitamin D deficiency, weakness was common when she had her son due to lack of awareness of vitamin D. Third collaborator, female APRN preceptor Hashimoto due to low level of vitamin D, reports injection of vitamin D but not sure if it was enough. Reasons for choosing collaborators: they have vitamin D deficiency related disease in common, they are familiar with vitamin D deficiency, they can provide awareness to others, they have all the tools to download the app. Reasons for using the collaborator help. They see the app as great idea because the app will help individuals track if they are getting enough vitamin D. Feel this app will encourage individuals to step out and get some sunlight. Report helping others by creating awareness of vitamin D deficiency. Report the app as encouraging since it can be accessed anywhere in the world. Own an Android, iPad, or iPhone to download the app. The mobile app, Dminder. Dminder is an app that offers vitamin D diet tracking for patients. Its purpose is to prevent vitamin D deficiency. The app allows patients to track diet, supplements, and even sun exposure. The app calculates patient D level according to their location and it works everywhere. It uses the last area to upload actual lab draws or data regarding the previous demographic. View the GPS and clock of the phone to determine the best time of the day to get the potential sun exposure for vitamin D conversion. Continuation of mobile app Dminder. The app is the only one to provide this method for the patient to track their intake, monitor their levels, and determine the best time to obtain the ideal sun exposure for skin conversions. It even alerts when it's time to get into the sun and when to get out to prevent sunburn. All doses of of vitamin D from the sun or supplement are used to calculate one current level continuously. And these are the references. Thank you.